Radial nerve. It is the largest nerve of the brachial plexus arising from posterior cord of brachial plexus, C5-C8, T1. Course. Arises in axilla from posterior cord of brachial plexus. Enters posterior compartment of arm at lower border of teres major through lower triangular space. Lies in spiral groove of humerus along with profunda brachii vessels between long and medial heads of triceps brachii. At lower end of spiral groove pierces lateral intermuscular septum to enter anterior compartment of arm. It enters cubital fossa at level of lateral epicondyle, terminates by dividing into superficial and deep, posterior interosseous nerve, branches. Superficial branch enters the forearm and runs deep to brachioradialis. In lower 1/3 road of forearm it winds around lateral aspect of radius to reach the anatomical snuff box on dorsum of hand. It terminates by dividing into digital branches. Deep branch or posterior interosseous nerve leaves cubital fossa by passing through the supinator to enter posterior compartment of forearm. Branches. Axilla. Sensory. Posterior cutaneous nerve of arm, supplies skin on back of arm. Motor. Nerve to long and medial head of triceps brachii. Spiral groove. Sensory. Lower lateral cutaneous nerve of arm, supplies skin on lateral surface of arm. Posterior cutaneous nerve of forearm, supplies skin of middle of back of forearm. Motor. Nerve to lateral and medial head of triceps brachii and anconeus. Anterior compartment of arm. Motor. Nerve to brachialis, proprioceptive nerve to brachioradialis and nerve to extensor carpi radialis longus. Cubital fossa. Superficial branch. Innervates skin over lateral part of dorsum of hand and dorsal surface of lateral 3½ digits up to middle phalanx. Deep, posterior interosseous nerve, branch, motor, to extensor carpi radialis brevis and supinator in cubital fossa. All extensor muscles of forearm, extensor digitorum, extensor indices, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis. Applied. Radial nerve lesion leads to wrist drop, loss of extension of wrist due to paralysis of extensors of wrist. If it gets injured in axilla due to pressure of upper end of crutches, crutch palsy, or in case of a drunkard falling asleep with arm passing over back of chair, Saturday night palsy. Results in I. Loss of extension at elbow joint. Wrist drop. Loss of extension of digits. IV. Sensory loss over posterior surface of lower part of arm and middle posterior part of forearm, lateral part of dorsum of hand and dorsal surface of lateral 3½ digits. In spiral groove the radial nerve gets injured due to midshaft fracture of humerus.